Look at this next illustration here, because this is actually with the vaginal tunic removed, that layer of the vaginal tunic that is on the outside. Now the parietal tunic is still here, isn't it? Because it's still enclosing all these structures. Even though it's illustrated here to be in a very thin fashion, I would say that's probably what they're trying to portray here with the mesorchium and so forth. But it's that tunic, or I'm sorry, it is that peritoneal extension that keeps everything in their functional position. All right. So what species do you think we've got here for an illustration? It's more typical of a stallion, isn't it? All right. And again, going back to those illustrations that we had for the testicular descent and everything, you can begin to see then where the gubernaculum may have a role to play in some of these different ligaments that are left down here. Any questions? Everybody with that so far? I'm trying to pace it here so that everybody... See, one of the reasons I'm approaching it this way is because some of you have fairly good understanding of reproductive anatomy. I mean, animal science or whatever your backgrounds are. But there's also some of us in the room here that maybe not have had the advantage of that. So we need to find a way to communicate together. So if there's any of you that are really bored with this, I would ask you to help out your classmates that may not have been so fortunate. All right. Let's take another look at this concept of this scrotum. Again, the spermatic cord is laid out here. And again, as you begin to see how this is laid down, you have your external spermatic fascia and your internal spermatic fascia. This is probably the area of separation when you've made your cut through the skin, through the scrotum. Skin dartos slides away, and so you're actually you're aiming to be right in between these areas. And so if you follow some of the other illustrations, you begin to picture how this, or why this is illustrated this way. All right, so again, this area here, if you were to take and bring this off, then you have your pampiniform plexus. Why do we have a pampiniform plexus? I may be getting ahead of myself here a little bit. A what? It's a blood-testes barrier. There may be some of that. What we're looking at here, what I'm thinking about, and what I'm going to mention here, is just simply the fact that where's that testicular artery come from? Straight down from the aorta. No branching, no turning, no convolutions until it gets to this area. Now, in most species, that's almost a vertical drop. So you can imagine what's going to happen with pressure and pulsations and everything else. But remember that testicle is in a tight sleeve, that tunica albuginea that surrounds it. All right, so there's only so much pressure that tissue is going to take. So with these convolutions, it's just like a river or a creek. The river has to slow down in order to make a corner. And so this is exactly what's going on here. So we have a pressure concern, pulsating and other things. We need to smooth that out so that it becomes a functional blood supply for the tissue that's in the testicle. But the other thing here is that we don't need all that heat from the body going into those embryonal tissues, do we? We just don't need that kind of heat. In fact, that's the reason that most mammalian testicles are hung down, is so that their temperature is lower than the core temperature. And so along with that, then we take our venous return, and it actually becomes a very elaborate network, a fine network. I'd almost mention a capillary bed. That's probably not the proper term for it. But it spreads out over the surfaces of these convolutions, and it begins to absorb heat. It begins to be a countercurrent heat exchanger. And that's what effectively then reduces the temperature. So, cremaster muscle, this is going to be a little bit of a diversion, a distraction here. The cremaster muscle allows everything to swing up and down according to the amount of temperature that's needed. All right, this is what is the status quo. This is the normal function, and then we can we can enlarge that function or that need or that response with some of the other control here. So cremaster muscle. See how this temperature control begins to work here. The dartos that I mentioned to you earlier, smooth muscle, it can also begin to pull the testicles, shorten the scrotum so that heat is conserved and they're taken out of harm's way if a fight or flight situation occurs. And where's the tunic where's the vaginal tunic? Where would we illustrate it on this one then? And so here we are. Again, we're looking at this very outside layer of that peritoneum that has evaginated out of the abdominal cavity. All right, any questions? Everybody's with it? Okay. Now, let's get into the real stuff. Maybe it's just a picture. And I hope I've got the full story right, but I'll do my best. What happens when you have a scrotal hernia, inguinal hernia, in an older animal? All right? If we were to try to relate this illustration and this picture, if we were to come across here, we'd probably be coming across here. Now, this is a very large animal. You can see here by this spermatic cord here that we've got a pretty good sized critter. In fact, the testicle pretty well fills this area here if I've got my orientation. But is this an open or closed castration? What are we talking about here? A closed castration is where you can make the separation between the internal-external spermatic fascia and then clamp this. Let's go back up here just a little ways. All right? A closed castration is where you can make the separation between these areas here, and we never enter into that vaginal tunic. Remember, I've been asking you to keep an eye on that vaginal tunic? If you can leave that vaginal tunic intact, it's a closed castration. And that's effective in most cases. For baby pigs with a hernia, you basically isolate the testicle, twist the cord around, tie it down with a suture to the belly wall or someplace where it can't get away, cut it off, and you're pretty well done. All right? But not in this full-grown bull. That inguinal canal could be large enough that we're getting omentum or even some loops of bowel into it. And the fascia is thick enough that you may not be able to accurately determine what's inside of that vaginal tunic. So opening, doing your complete work that way, you can be sure, and you can assure the client that you've gotten the hernia repaired and so forth. Okay? Trying to bring some of the clinical aspects in here so that some of these different layers begin to make sense to you. All right, that's enough on the scrotum. Let's talk a little bit about some of the accessory glands that are going on here. Sperm are not the only thing that's in semen. All right? There's conditions that exist either in the urinary tract of the male or in the vaginal tract of the female that sperm cannot survive in without having some conditions made right. And so some of these glands are involved in that. And I'm not going to get into that, but what I can tell you is that different species have a different emphasis on how they use their glands. What I'll just note here is that the ambulatory glands, and that's why this one here is in parenthesis, some of these ambulatory glands are probably present, but they're not always so anatomically prominent. All right, the rest of these you can begin to see where the dog has a very large prostate, the vesicle gland is large in the ruminants, and you can then pick up that the bulbourethral gland can be very expansive in the pig, and so forth. All right? The horse just seems like they've got a little bit of everything. All right. Let's take a look at some of the pelvic anatomy, and then we'll look at some of the penis structure, morphology, and we'll try to get into some of the circulation that is important to the operation of this whole thing. All right, on the bull. And again, I put the key over here for your future study. If you have the genital fold, you can begin to, from the peritoneum, the abdomen here, you can begin to see how these different structures come together. Remember, if we go back to one of those first slides, how all these males are configured in just a little different format. And so that's what we're looking at here, is trying to make sense out of this in such a way that when you think of doing a rectal on a bull, for example, or a rectal on a stallion, or even do a digital exam on a male dog, you can begin to see where some of these things might make sense to you. But for breeding soundness, yes, you want to be in that bull for a rectal to make sure that some of these things are being considered in your evaluation. So let's take a look. And if we take a look, the ductus deferens with the enlarged ampulla. All right, we've got an ampulla here. Yes, ruminant has some. That makes some emphasis of it. All right. And then we have the ureters coming in. So forth. And you can make sense out of this. The vesicular gland, or the seminal vesicles in the horse, so to speak. Excuse me. So the pelvic urethra then begins to leave the bladder. It comes on through many of these different organs, or these glands, then begin to make their contributions through various ducts that enter. And of course, as the semen then comes along the ductus deferens and through the ampules, you can begin to see then where things begin to get mixed up and things begin to get blended, so that when these sperm are finally sent on their way, that they have every chance that they can possibly have of successfully accomplishing their mission. All right, some of these different glands. One of the things I'll just mention is I'm not going to get into much of the musculature, the genital musculature on the male this lecture. I'll try to bring that in next time when we finish up with the pig and so forth. But again, here's the key. And if you want to take some time, and then take this and compare to what you're doing in the lab today. Compare it with what you're finding. And I'll try to bring in some more topics here. Stallion. How many of you have male horses? Okay, so you're going to have a chance to get into some of this as you get along. But again, here's your layout, and we've pretty much shared the same key across all the species, if you take a look. And so if we go to the pig, then we can look at, again, here we go. Pay attention to how the pelvic structure is laid out here. And then again, you can begin to get a relative idea. Let's take it the bulbourethral gland, and in the pig, yeah, here we go. All right, so that's where the chart comes from, table comes from, and you can begin to look at some of these things. Any questions on morphology here? One thing I would like to mention, this is out of a day gone by in the profession, but even before I got into veterinary school, the large animal practitioner would come out, castrate the cat, or cats. They go into the boot, no anesthetic required in those days, or in a gunny sack turned down so that they could be felt and finally cut. But there's no ligation. Testicles were isolated and pulled out until the ductus deferens broke. What is wrong with that sort of procedure? Anatomically, what is wrong with that kind of procedure? I don't have a cat to show here, but I can tell you that this ductus deferens comes around medial to the ureter. And when you begin to put traction on it out through the scrotum, that ductus deferens begins to pull against the ureter. There were cats that did not survive castration because of uremia, because the ureters were torn and they died of peritonitis. All right? So we've gotten better, haven't we? And I'm not telling you that so you can mimic it someday. In fact, I would strongly discourage it, because the chances are, first of all, it's painful to the animal. Secondly, we can do better than that for these animals. All right? See how that anatomy comes to play, even on the cat. Something that's not part of this today. And so when you go through this, you can begin to see how this anatomy plays out. All of these vas deferens wrap around the